that I could not have children and that there were no medications. Really, there's nothing to do but wait. And that was in 1991. He also told me to get my husband tested, and we were just kind of assuming that if I had it, he had it. But that's the funny thing about this disease, is that that doesn't guarantee that the other person has it. So even if one person gets tested, they usually assume that that's the status of the couple, and that's not true because my husband tested negative. So I encourage all of you that if you've been at risk to get tested, or if you know anybody who's been at risk, encourage them to get tested. We have wonderful, wonderful testing options in the state of Florida. We have a new HIV test, which is a 20-minute test. You know, you can have your test results in 20 minutes and know. Now there's also something called the window period that you need to be concerned about, especially with that 20-minute test. If you go out today and have unprotected sex and get infected with HIV, you will not know it. Believe me when I tell you, you will not look any different, you will not feel any different. I know for a fact this virus was in my body for at least 5 years before I was diagnosed. I was teaching 15 aerobics classes a week. I was in my 20s. I was and still am one of the healthiest people I know, except for a couple minor little viruses roaming around in my body. But you know, you will have absolutely no idea that this virus is in your body. If you get infected today and you wake up tomorrow morning and say, oh, wait a minute, I better go take an HIV test, you will not test positive. Because we do not actually test for HIV. We test for the antibodies that your body starts to produce. And it can take 2 weeks to 3 months for those antibodies to show up. So even if you get tested, if you do the 20-minute test or you meet somebody that you want to take your relationship to the next level, having them tested isn't the only thing that you need to do. Because